Hi there, it's Dr. Christina Bosner, the Dr. Biohacking Supermom, and today we're going to be talking about when gluten-free, dairy-free doesn't cut it. First of all, dietary changes will radically shift your health. If you're suffering from symptoms of chronic constipation, diarrhea, irritable bowel, if you have skin conditions like eczema and rashes, if you have a child with a nervous tummy or anxiety, I strongly recommend you go gluten-free, dairy-free. Why do I recommend this? Because these conditions are signs that your body has inflammation, and the top inflammatory foods out there are gluten and dairy. By any chance, have you already tried going gluten-free, dairy-free, and you're still having these chronic symptoms? Today's video, I'm going to talk about when gluten-free, dairy-free doesn't cut it, and why. The first reason why going gluten-free, dairy-free doesn't cut it is because you're not going 100%. So many of my patients come in and tell me, I've gone gluten-free, dairy-free, and I'm still having symptoms. But when I ask them more questions, they tell me, well, we've cut down. I'm only having it once a week. Did you know that even once a week, a small amount of an inflammatory thing in your body will trigger your immune system the same way as having a whole block of cheese or a whole baguette? So if you've cut down and you actually haven't gone 100%, you've done all the hard work. Do it 100%. It's difficult to do if you're only doing it 85 to 90%. Your immune system still sees that little tiny amount as inflammatory, and it will keep your immune system on high alert. This may prevent you from actually getting the results that you could achieve if you had just gone 100%. The second reason why gluten-free, dairy-free isn't cutting it, it's because you haven't done it for long enough. Oftentimes patients present in my office saying they've done a gluten-free, dairy-free diet and they've done it for a week or two. Why is this not long enough? Our body and our immune system recognizes the proteins in gluten and dairy, gliadin and casein. And if it is inflammatory to our body will see these two proteins as dangerous strangers and will create inflammation. Hence, we have these symptoms we're having. The antibody half-life of these proteins is usually 21 to 28 days. If you've done a gluten-free, dairy-free diet for a week or two, it's not long enough. I highly recommend going a minimum of 4 weeks. If you have severe chronic conditions, my recommendation is 100 days elimination. And this allows your immune system to decrease its antibodies to these two proteins. This will give you a much better indication of how inflammatory these two things are in your diet, and you will see a radical shift in your health. The third reason why gluten-free, dairy-free doesn't cut it, if you've already done it 100% and you've done it for a minimum of 4 weeks, is that there are other factors that may be involved. A healthy person will have an entirely new intestinal lining in 2 to 3 weeks. This means if you're doing a gut healing protocol for 6 months, 1 year, a year and a half, and you're still having the chronic symptoms, there's other reasons. Genetics can play a factor. The health of the microbiome can play a factor. Environmental toxins, stress, and a whole list of other things that impact the body can have an impact on your chronic health condition. Gluten-free, dairy-free is the first step because gluten and dairy are some of the most inflammatory foods known to humans. Stick to it while still addressing those other factors I spoke about, and you will see that decreasing the amount of inflammation that's coming from food will help you heal faster. If you know someone who says gluten-free, dairy-free doesn't cut it, make sure they watch this video. Thanks for watching, and leave me your questions and comments below. And for more videos like this, join me in my Myth-Busting Motherhood Facebook group.